not always done at 20 weeks. It's done anywhere from 18 to 22 weeks. And sometimes it's done earlier than that. And sometimes it's done later than that. So there's a couple things you want to know before you do that anatomy scan. Now, for me, the anatomy scan isn't that big of a deal. I would, however, turn down any ultrasounds before that, prior to that. And if it were me, I would wait until the 22-week mark, because there is evidence that shows that ultrasounds are dangerous and can cause damage to the fetus. So we don't want to expose them to too much of that. The reason it is dangerous and can cause damage to your fetus is because ultrasound is radiation. It is a sound wave and it is radiation, regardless of what they tell you about how safe it is. They switched from X-ray to ultrasound to make you think that it was safer. And maybe it is at some level, but at the same token, there have been studies done that show that it is dangerous and that it can cause damage to the fetus in utero. And so you want to control the amount of ultrasounds you get. So knowing that you have the right to decline any of these ultrasounds is key. So knowledge is your best friend when you're walking through pregnancy. The more you know, the better you can do for you and your baby. Now, today I was looking into some more information about this. And so, like I said, they're usually done between 18 and 22 weeks. And during the anatomy scan, the technician is going to be doing measurements of the size of the head, the spine, to make sure it's all aligned, that the skin is over the bones, and many other things, internal organs, measuring them. They're going to be checking these things to see if your baby's on course for their growth, or if they're running small, or if they're running too big. However, when they're doing that, if they're taking too long, they could cause damage. And another thing that they could be checking for, or would be checking for during that, is they're going to be checking your placenta, and they're going to specifically be checking for placenta previa, which placenta previa is when your placenta is low and close to the cervix opening, which at 20 weeks, 22 weeks is really early to diagnose that. So if they do try to pressure you with just that, like, oh, well, we need to know, you can push back until like 34, 35 weeks. And even if they tell you that you have placenta previa, just know that your placenta generally will move up as your uterus grows with the baby. So if it is low lying, it more than likely will move up. And that's why I say 20 to 22 weeks is really early to diagnose placenta previa. So there are risks involved with ultrasound. And so I found this quote, and it's kind of fun, or I found this video actually of this doctor, Robert Mendelsohn. And funny thing, I'm reading this book and I didn't even realize it was the same guy until I read more in the description of the video. And I was like, oh, hey, I have that book. And so in his video, he's talking about the dangers of ultrasound. And he says that, and this is to quote him, it says, there are at least a dozen experimental studies showing damage from ultrasound, including in the biochemistry of the child, the damage to the immune system, and damage to or delay maturation of the nervous system, the central nervous system. And then he also went on to say something to the effect of that with increased use of ultrasound, there has been an excess number of children having leukemia. And in his book, I was just looking through, and this book was written in 1981, so it was before ultrasound was mass used, and he discussed the use of x-ray and how they found a connection between women being x-rayed to see their baby and the rise in leukemia in children. And I find that interesting because it's true. There are a lot of women getting x-rays today, and you hear it all the time where a mom is just broken over the news that her son has leukemia and is very sick, right? And it's sad that our medical system is has some responsibility in that, and they're not sharing that. So I will put the link in the description of this video and in the comments wherever you're watching this. If you're watching this in my group, thank you for being here. If you are not yet in my group, you can join my group. You can find me at Open Minded and Empowered Birthing Mamas on Facebook. You can also follow me on YouTube at Amanda Ignat. And I think that's it. I just wanted you to be aware that there are risks and that knowledge is your best friend. So learn as much as you can, and then make decisions based on what you know, and limit a technician. Say, hey, I give you 5 minutes. That's it. It's your body, and you have the right to decline, and you have the right to allow them access and limit it at the same time. So I hope you found this information helpful, and I will see you again tomorrow. Bye.